Dr. Vikki Petersen. I received a very interesting question today. It was from a woman who was diagnosed with celiac disease 3 years ago. She also has a rare autoimmune skin disease. It's called mixed connective tissue disease. Further, she suffers from canker sores in her mouth and geographic tongue. And she asked if her mouth condition could be related to celiac disease. The answer is definitely yes. She also mentioned that she really tries to stay on her gluten-free diet and doesn't really knowingly go off. Yet, with having a rare autoimmune disease, and what we know is that autoimmune disease is definitively connected to gluten sensitivity and celiac disease. So the fact that she's developed that, the fact that she has canker sores and geographic tongue, both showing malabsorption, one thing we know for sure, she is not absorbing the way she should, and thereby her small intestine is not functioning the way it should. So why has her healing not progressed after 3 years? Is she still getting into gluten, albeit unknowingly? Is some little thing in her diet still causing problems and she hasn't identified it? Perhaps she's on a medication that has gluten in it and she doesn't realize it. Perhaps she's of the Catholic faith and is taking a bit of a wafer when she goes to church, which there was a very interesting story about a nun who was literally taking 1/16 of the size of your thumbnails worth of a wafer, and that was enough to keep her from getting healthy. So what we know about gluten sensitivity and celiac disease is it doesn't take a lot. A little tiny bit can be enough. So number one, I would definitely have her rule that out. If that's not the issue, then number two, we go to the secondary types of issues that are preventing healing of the small intestine. Does she have a secondary infection, which is very common? Parasitic infection, amoeba, bacteria, fungal or yeast. Is something like that occurring in her small intestine? We here at the clinic do a stool test to find out if that's the case. If it is, that will prevent those organisms, keep a lot of inflammation, damage occurring in the small intestine, and prevent it from healing. The other thing that can happen is that she doesn't have enough good bacteria. Perhaps she needs a lot of probiotics in her system to really keep the health of her small intestine occurring. So these are the areas that we would look at. But the one thing I really want to get across in this type of scenario is if you are trying to be good because you're gluten sensitive or you have celiac disease, but you're still having health problems, don't give up and don't think that it's not associated with the damage that gluten can do, because it most often is. There's just something else that's occurring secondarily, tertiarily, that needs to be looked at. So hang in there, don't give up, and keep searching. The small intestine loves to heal. When you take enough stress away from it, it will heal. Much like a cut on your body, if it has the raw materials with which to heal, it will. So what we know with this individual is her intestine doesn't have the raw materials. There's too much stress coming in on it, and it's unable to heal itself. So I hope that helps, and until next time, to your very good health.